Have you ever wondered what exactly is meant by the term erectile dysfunction? Well, let's break it down. Erectile dysfunction, often abbreviated as ED, is a medical condition that affects a significant number of men around the world. At its core, it's the inability to get or keep an erection firm enough for sexual intercourse. But to truly understand erectile dysfunction, we need to first comprehend the physiological process of achieving an erection. Imagine a complex dance involving nerves, muscles, hormones, and blood vessels, all working in harmony to create an erection. When sexual thoughts or direct contact stimulates the brain, it sends signals down the nervous system to relax the muscles in the penis. This relaxation allows blood to flow in and fill the open spaces inside the penis, causing it to swell and become erect. However, if there's a disruption in any part of this delicate process, it can lead to erectile dysfunction. This disruption could be due to a variety of reasons such as underlying health conditions, emotional issues, or certain lifestyle choices. The result is the same: an inability to achieve or maintain an erection satisfactory for sexual activity. It's important to note that occasional trouble with maintaining an erection is not cause for concern. It's when the issue becomes ongoing that it might be a sign of erectile dysfunction. And while erectile dysfunction is primarily a physical condition, its effects extend far beyond the physical realm. It has a significant impact on a man's psychological well-being too, often leading to stress, anxiety, low self-esteem, and relationship problems. The ripple effects of erectile dysfunction can be far-reaching, affecting various aspects of a man's life and well-being. So, erectile dysfunction is not just a condition that affects one's physical health, but it also has a significant impact on psychological well-being. Now that we understand what erectile dysfunction is, what are some common causes? Erectile dysfunction can be the result of numerous factors, with both physical and psychological elements playing a role. Let's talk about these in detail. Firstly, certain physical conditions can lead to erectile dysfunction. These include heart disease, high blood pressure, diabetes, and obesity. It's not just about the direct impact these conditions have on your sexual performance, but also about the effect they have on your blood flow and nerve function, both of which are crucial for maintaining an erection. Another significant physical cause is the use of certain medications. Drugs used to treat conditions like depression, anxiety, and high blood pressure can sometimes have side effects that cause erectile dysfunction. But remember, it's essential not to stop taking your prescribed medication without consulting your doctor. Moving on to lifestyle choices, habits like smoking and excessive alcohol consumption can also contribute to erectile dysfunction. Both of these habits can damage your blood vessels, leading to reduced blood flow to the penis, thereby affecting your ability to achieve an erection. Now, let's delve into the psychological causes. Stress and anxiety, for example, can interrupt the signals your brain sends to your body to initiate an erection. Furthermore, mental health conditions such as depression can also contribute to erectile dysfunction. In some cases, the worry of not being able to perform sexually can lead to a vicious cycle of erectile dysfunction, creating performance anxiety. It's important to note that erectile dysfunction can also be the result of a combination of physical and psychological issues. For instance, a minor physical condition that slows your sexual response might cause anxiety about maintaining an erection. The resulting anxiety can lead to or worsen erectile dysfunction. As you can see, erectile dysfunction can be caused by a variety of factors, and understanding these can help in managing the condition. If you suspect you might have erectile dysfunction, how can you confirm this? It's a question that many men might find themselves grappling with. Well, the diagnosis of erectile dysfunction, also known as ED, is typically a two-part process involving both a discussion with a healthcare professional and a physical examination. The discussion with your healthcare provider is often the first step. They may ask you about your sexual history, your overall health, and any symptoms you have been experiencing. Questions may focus on things like how often you're able to achieve an erection, whether you can maintain an erection, and if you're experiencing reduced sexual desire. This conversation might feel a bit uncomfortable, but it's crucial to be as honest as possible. The more information your healthcare provider has, the better they'll be able to help you. Your healthcare provider might also ask about your lifestyle habits. This could include questions about your diet, physical activity levels, alcohol consumption, smoking habits, and even your mental health. Erectile dysfunction can be linked to a range of physical and psychological factors, so these questions can help to identify any potential underlying causes. The second part of the diagnosis process typically involves a physical examination. This can help to identify any physical causes of erectile dysfunction. Your healthcare provider may check your blood pressure and heart rate, and they might also examine your penis and testicles. In some cases, they may also recommend further tests like blood tests or ultrasound scans. The aim of this diagnostic process is not just to confirm whether or not you have erectile dysfunction, but also to identify any potential underlying causes. This is vital for determining the best course of treatment. Remember, erectile dysfunction is a common issue that many men face, and it's nothing to be embarrassed about. It's important to remember, if you have concerns about erectile dysfunction, seek professional medical advice. There's no need to suffer in silence. There are many treatments available that can help you regain your sexual health and your quality of life. Now, let's delve into the various treatment options available for erectile dysfunction. First off, we have lifestyle changes. These are often the first line of treatment recommended by health professionals and can have a significant impact on overall sexual health. This can include regular exercise, maintaining a balanced diet, limiting alcohol consumption, and quitting smoking. These changes work by improving blood flow throughout the body, including to the penis, which is essential for achieving and maintaining an erection. Next, there's medication. There are several types of medication available that can help men achieve an erection. These include PDE5 inhibitors, such as sildenafil, tadalafil, and vardenafil. These medications work by increasing blood flow to the penis during sexual stimulation. While these medications can be incredibly effective, it's important to remember that they are not a cure-all and may not work for everyone. Also, they can come with side effects, so it's crucial to discuss this with a healthcare provider. Then we have therapy. Psychological factors such as stress, anxiety, and depression can often contribute to erectile dysfunction. Therefore, cognitive behavioral therapy or sex therapy can be beneficial in addressing these underlying issues. Therapists can provide strategies to manage stress and anxiety, improve communication with partners, and boost self-esteem, all of which can enhance sexual performance. Another treatment option is the use of devices such as vacuum erection devices or penile implants. Vacuum erection devices work by drawing blood into the penis, causing an erection. On the other hand, penile implants are a surgical option where a device is implanted into the penis to allow men to achieve an erection. These treatment options are typically considered when other treatments have not been effective. In certain cases, vascular surgery might be considered. This is often reserved for men who have a physical blockage preventing adequate blood flow to the penis. The surgery works by bypassing blocked arteries to restore blood flow, thus improving the ability to achieve an erection. Lastly, it's worth mentioning that some men may benefit from testosterone replacement therapy. This is typically reserved for men who have low testosterone levels in addition to erectile dysfunction. The therapy works by supplementing the body's natural testosterone production, which can improve libido and erectile function. Remember, everyone is different, and what works for one person may not work for another. It's important to have open and honest discussions with your healthcare provider to find the most effective treatment option for you. While erectile dysfunction can be a challenging condition to manage, there are several effective treatment options available. So, don't lose hope. There's a world of help out there, ready to assist you in regaining control over your sexual health. To sum it all up, we've unraveled the mystery of erectile dysfunction, a condition that many men experience but few discuss openly. We've delved into its common causes, from physical conditions like heart disease and diabetes, to psychological factors like stress and anxiety. We've looked into the process of diagnosing this condition, underscoring the importance of an honest conversation with a healthcare provider. Finally, we've explored various treatment options from lifestyle changes to medication and therapy. Remember, erectile dysfunction is more common than you might think, and there's no reason to let it stand in the way of your happiness and well-being. It's a condition that can be managed with the right help and support. Thank you for joining us in this educational journey. Don't forget to like, comment, and subscribe for more informative videos. If you need more resources on erectile dysfunction, click the link in the description below.